everyone. My name is Lajos Kemény. I am the editor-in-chief of the International Journal of Dermatology. Our guest today is Dr. Defne Özkoca, who is the section editor of inflammatory skin diseases in the IJD. But first, let me introduce you Defne Özkoca. Defne is a board-certified dermatologist currently working in Başakşehir Hospital, one of the largest public hospitals in Istanbul, Turkey. She is not only responsible for patient care, but she plays also an active role in education of dermatology residents and research. Dr. Özkoca has completed his residency at Istanbul Medical Faculty in 2021 and has become an associate professor of dermatology that year. His main research focus in dermatology are hidradenitis suppurativa, hair diseases, and cosmetic dermatology, and especially laser medicine. During her relatively short academic career, she has contributed already to more than 50 scientific articles and has written 30 book chapters. She became a part of the IJD 2 years ago as a junior editor with Dr. Cecil Vural, and now she continues the work as a section editor of inflammatory skin diseases. Together with Dr. Vural, she has initiated a national hidradenitis suppurativa research group in Turkey. Ongoing national research topics of that group are the impact of HS on fertility and sexual well-being of patients, and the impact of treatment modalities of the quality of life of HS patients. So Defne, welcome you here in this podcast episode. And let's start with the question, how did you join and why did you join to the IJD as junior editor? What was your motivation to join to the journal? And are you happy with this position and especially with this new one? So please share with us your thoughts about the journal and about the scientific publishing.
Thank you very much for the kind introduction. I joined the team with Dr. Vural, who is my mentor, even still that I'm not her junior editor, but everyone is still calling me Junior Seçil in our clinics and in the Turkish community. So it all started when Dr. Seçil, who I call Seçil Abla, personal relationship, she asked me do you want to are you interested in reviewing articles or publishing stuff? Because she knew that before I started working with her at the same hospital, she knew that I was interested in publishing and also in academic articles. So she asked me if I would be interested, and I said, yeah, great. And she said, it's IJD, by the way. I said, yeah, you tell me that it's IJD the last. It's one of the best journals in dermatology. So I was a bit shocked and very honored to be a part of this team. So it's just started that like that. And being part of that team, I learned a lot, especially from Dr. Vural. And continuing her work as the section editor right now is such a big privilege. And I feel so honored to be at this position in a very early age and very early career point. So I'm very happy to be here.
Yeah, it's a big privilege, but on the other hand, it's a lot of work, I think. How can you make this time management? Because you are working with patients, you are involved in research, and now you are working also for the journal. How many hours do you dedicate for the journal, for example, in one day or in patients' care and research? It could be interesting to know.
For the journal, it depends on actually the number of the manuscripts that we received that week, but approximately, I think I dedicate about 1 to 2 hours each week. But I try to log into the journal every day to see if there is a new submission or anything like that. I usually do it when I try to do it in my own work day within the working hours. And when I'm like just with my computer, I just say, okay, I need to log into IJD and look at it. And it starts that way. And then I usually try to keep up every day. But there are times that I cannot keep up. And at that times, it usually goes like I log in 2 to 3 days afterwards and see a lot of things that are waiting for me piling up. So then it takes a bit more time. But when I log in every day, it just usually takes about 10 to 15 minutes for me when I do it like in a controlled manner every day.
Yeah, it's actually really great what you are doing, because if you log in each day to the system, to the platform, then it's always the best, because you see what is going on, and you have to make decisions and to invite in reviewers. That's always the best way how to work for the journal. But you are also involved in patient care. How is in Turkey, in your hospital, how many patients do you see in a day? You are working in a special outpatient unit, the HS, and how it is regulated, and how are you working? Do you have also private practice maybe, or how is it in Turkey?
In Turkey, you're not allowed to have a private practice if you work in a public hospital or in a university hospital. I used to work in a private university hospital, but we had relatively lower numbers of patients, especially for the training of the residents. So I recently switched to a public hospital. And in public hospitals, we have a huge number of patients, like
what does it mean in a day, in an outpatient day, in a normal day? How many patients do you see personally?
I personally see around like 30 to 40, but we have many residents, so they see a lot of patients under our supervision. So I can say that it's about like 200 patients a day per doctor, which is a very huge number. In Turkey, it's we are a bit short of dermatologists in Turkey, especially in the public sector. Yeah. And a lot of people are trying to would be not the correct word, but a lot of people are shifting to the cosmetics parts and like private practices. So there is an incredible decrease in the number of classic dermatologists who are interested in like diseases such as hidradenitis suppurativa, psoriasis, and atopic dermatitis, which makes the job of the university hospitals or the teaching clinics even more difficult, because sometimes we get patients from all around the Turkey, not just Istanbul, but they come because there is no patient care in their village or anything like that. I think it's similar in European countries as well, that the big centers attract the patients from other parts of the country as well.
Yeah, it's the same problem from all over the world, actually, that cosmetic dermatology is extremely popular, and if you are doing it in private office, then you can earn much more money. And those ones who are really dedicated for really severe diseases, medical dermatology, then there are less and less dermatologists, and they have to work more and more, and they have to see more and more patients. On the other hand, when I remember back when I was younger, I've seen also 30 in between 30 or 40 patients a day, and even during the evenings. And I see that you become better dermatologist if you see more patients. So this is somehow not really good if you see that there are a lot of patients still waiting for you. On the other hand, from each patient we can learn a lot, and if we see more patients, then we'll be better dermatologists.
Definitely true. But when I was working in a private university hospital, I used to see like around 8 to 10 patients a day, and it wasn't as satisfying as it is now for me. Or back in my residency, I used to see about 100 patients a day, and from each patient you learn something. Sometimes we see very rare diseases, and as the number increases, the diversity of the patients that you see also increases. And I believe you learn something from every patient. And I remember the very dramatic patients. And I don't know, it helped me on the board examinations as well, seeing too many patients. I think it's one of the perks of practicing in Turkey, I guess. We have a lot of patients and we learn a lot from these patients.
Yeah. But you are also involved in research. Could you talk about your personal research topics and what is your main research interest?
Currently, we are doing a lot of research on hidradenitis suppurativa with Dr. Vural. I actually have a personal connection with hidradenitis because one of my classmates has been diagnosed with hidradenitis suppurativa when I just started working with Dr. Vural, and she's so experienced in that field, and I wanted to consult my friend to Dr. Vural, and that's how it all started. She was complaining of all the aspects of the disease that it is impacting her life. And in Turkey, there was a nomenclature for the disease in the past between the patients that it was called the dog memory disease, something like that. And it was a very stigmatizing the patients, and it has a huge impact on the personal lives, the quality of life of the patients. So we started to starting with my friend's ideas that she gave me, and we started to work a lot about the quality of life of the HS patients, and especially the fertility among the female patients, about the sexual desire indexes, both in males and females, and also the fertility indexes in the females, and about the miscarriages that they...
What were your major findings?
Yeah, we're actually still, we have concluded the gathering process, but we're still doing the statistics of the research. So,
but maybe you have some preliminary data.
The location of the lesions, depending on the location of the lesions and the increase in the severity of the disease, the sexual indices decrease, like the patients feel less aroused, or they feel that they don't want to have a child, or they feel that their fertility decreases. But still we need to do the statistical analysis to give more information.
It's really an extremely difficult disease because probably the surgery is the best treatment, although we do have already biologicals, but in early 3, usually surgery is the way with which we can help the most for the patient. As dermatologists in Turkey, do you operate a lot, or these operations are done mainly by surgeons? For example, hidradenitis suppurativa, deroofing probably done by dermatologists, but big surgery, I'm not sure. I'm not familiar with the system.
Actually, it depends on the centers, and we have a great center in Ankara, another city of Turkey, where they do all of the minor surgeries themselves, and they are very equipped and they are very experienced about hidradenitis suppurativa. So sometimes we refer patients to them as well, because the disease is not known very well by the general surgeons. I don't know if it's the case in other countries as well, but in Turkey, many of the general surgeons don't know the disease process, or they don't know that it's an inflammatory disease. They just think of cutting it out and then it recurs. So we try to work together with the general surgeons in Istanbul, and we usually send our patients or refer our patients to the same surgeon, because he becomes more experienced and he gets used to the patient. But there are some dermatologists in Turkey who do the surgical stuff as long as they can It's allowed actually, because some big surgeries are not allowed to be done by a dermatologist in Turkey. And I think that they're doing a great job, and we always listen to them in the congresses, and we're very proud of them because they're doing such a great job. There is one center who is very experienced about this in Turkey. But other than that, we usually have to send our patients to the general surgery with close relationships with the general surgery department.
Yeah. In Hungary, it's probably more or less the same situation. There are some centers who are doing everything, even dermatologists, and other ones when they find the proper person who can do the surgery. But I know that you have another interesting topic about the JAK inhibitors in granuloma annulare. Could you talk about this research a little bit?
We actually, when I was working with Dr. Vural as her junior editor, we evaluated an article about the JAK inhibitors in granuloma annulare, and then you invited us to do a commentary on the article. I actually am very interested about JAK inhibitors because they are like a rising star in dermatology in every disease. And my personal interest started when we were using tofacitinib for alopecia areata patients when I was a resident. And I think we were one of the centers that use tofacitinib for alopecia areata in Turkey, and everyone was referring patients to us. And with that, my interest in the JAK inhibitors started, and along with the years, the indications increased a lot. And about the JAK inhibitors in granuloma annulare, in very refractory cases, there is a potential for the JAK inhibitors in the treatment of granuloma annulare, especially the tofacitinib was the most commonly reported one, the 5 milligrams per day posology, but also the topical form of tofacitinib and ruxolitinib were also tried. The other JAK inhibitors were tried as well, but they were not reported as much as tofacitinib. So I think JAK inhibitors are very promising in all areas of dermatology.
Yeah, I completely agree that JAK inhibitors completely changed the life of many patients, mainly, of course, in atopic eczema, atopic dermatitis, but also other indications, off-label indication. It is used more and more, and really the patients are really highly satisfied with the efficacy. But probably you are using also a lot of biologicals in HS and...
Using a lot of biologicals, but I think it might be similar in your country as well. There is a bit shortage in the repayment of the biologicals by the government. So sometimes the patients have to pay themselves, or like, for example, for dupilumab, the patient has to be contraindicated for JAK inhibitors in order to receive dupilumab.
The same in Hungary. That is the same in Hungary. Yeah.
That's a very challenging situation for us because sometimes some patients respond better to dupilumab. And for example, like one of the indications of being eligible for dupilumab by the government in Turkey is that the patient has a previous thromboembolism history, like depending on the side effects. But I think it would be much better if we could like choose the treatments for the patients ourselves instead of the regulations. But still, we have a chance to use the biologics. That's for sure. That was a game changer in many of the diseases.
Yeah, can you actually combine, I would say, Dupi with JAK inhibitors in extreme therapy resistant cases? Is it allowed by the government or by the insurance, or?
I never personally did that, but thinking about what others are telling and about other diseases that we tried, you can combine, but you have to apply for a special permission through the internet system. It might be the same for you as well. And we apply to the government through through web, and we need to submit all of the patient's files, photographs, and the treatment history. And in the past, they used to give more permission, but acceptance ratio is very decreasing currently. Like when I was a resident, tofacitinib was paid for alopecia areata if you submit this application for the patient. And now government does not pay for either baricitinib or tofacitinib for alopecia areata patients. They have to buy it by themselves.
Oh, God.
But it's paid for like rheumatoid arthritis, but not for alopecia areata. They have to buy themselves, and which makes like around €100 a month for a patient, which in the economy of Turkey is a big burden for the patients. But
yeah, more or less the same. Fortunately, in Hungary, the JAK inhibitors are reimbursed for the patients if they have alopecia areata. We need a special documents for that, but usually we receive it automatically, so it is not a big issue. That's really pity that not all the patients can receive the JAK inhibitors, because alopecia is sometimes considered as just a cosmetic disease. However, if I think on a young lady without any hairs, alopecia totalis, and then that is really a huge problem for them, psychological issues, and I think that this is really something that we have to treat. But
that the JAK inhibitors not being reimbursed for alopecia areata in Turkey is one of the biggest challenges that we face right now. It's reimbursed for atopic dermatitis, but alopecia areata is like an orphan right now for us.
Yeah. Mm-hmm. Good. Then I know that you are working also with lasers. It is one of I consider laser treatment as my hobby, actually. And I really also like. What do you do? A lot of laser treatments. Are these reimbursed in Turkey, or the patient should pay for the? I would say rosacea or skin rejuvenation.
The treatments are not reimbursed by the government, but we mainly do a lot of research projects, and in that way, the patients either pay a very little amount of money or they don't pay at all, that are reimbursed by the companies or the either the laser companies or the drug companies.
Oh, what kind of research are you doing right now? What kind of research? If it is not top secret.
Now no, it's not top secret. Right now, I don't have a laser research. I'm a bit more focused on HS. But when I was a resident, we usually did some case reports about the genodermatosis. For example, we had a patient with Gold syndrome, and she had widespread striatistantia due to her growth spots. And she had a lot of pain in those citria because the underlying fat tissue was protruding, and I performed Erbim laser for her, and the citria got really better, and her concerns were not cosmetic, but actually her quality of life was very decreased. So she was very happy with the results. That's one I can think of. And other than that, we had some porokeratosis patients that we treated with laser. I actually like laser treatments for medical dermatology a lot, but going on with the trends, I do it for rejuvenation as well. We had a research about peri-oral and peri-orbital fine wrinkles, and fractional Erbim laser was very effective in the rejuvenation of the perioral and periorbital areas. But the response of the patient dramatically decreased with smoking. So that was a major drawback.
Yeah. Another question about laser and HS. Do you do hair removal for HS patients to prevent the progression of the disease?
we recommend hair removal for the HS patients, not only for HS patients, but for the patients with recurrent folliculitis in the buttocks area. And I think it's very good for the patient. But personally, I don't perform the hair removal laser myself. In Turkey, actually, we have a bit dilemma about it. It's still discussed if it should be done by the doctors or the beauty practitioners, and along with other topics of cosmetics medicine that are within a dilemma, that the hair removal is also a dilemma in Turkey.
Yeah. And going back to the journal, what do you think that the biggest problem with the journal and in your position as a section editor? Finding reviewers. How can do you have any tips? Do you have any tips for other section editors? How do you find good reviewers?
I actually sometimes force my friends to review some articles.
That is the best.
When I cannot find a reviewer, I try to pull strings myself and ask my friends for the help, and for sure the friends that I trust the most and who are very good authors themselves. So there are a couple of friends that I always ask, and they know themselves, and they help me a lot. And they're very promising academicians in the future. So I think that's helpful for themselves as well. But finding reviewers, I think, is the hardest part of my job. And usually the delays in the processing of the articles is due to finding reviewers. And I myself, as an author, also face the challenge of finding a reviewer for my manuscripts as well. And it takes a lot of time when I submit an article to another journal. I automatically know that it will take time. Being on this side of academic told me that it takes a lot of time and work for the article to be processed. So one of the strengths of joining this journal for myself was to see the other side of the journal, not just the author, but the editor side as well.
Yeah, the most efficient way definitely to call your friends and please make a favor and review that and that paper. But on the other hand, if you have a lot of papers, then you cannot ask over your friends because they will run away if you if you call them. That sometimes it happens in my department that I'm working in the department and the colleagues are running away. Okay, I did already my job, please. So this is not really easy.
I'm lucky that I have a lot of friends who are very interested in dermatology, I guess.
That is great. You have a big network.
Yeah, I have a group of very young friends who are between 30s and 40s and very interested in dermatology, who are either associate professors or assistant professors, and they want to contribute a lot. And the name IJD is very flashy for them, so they accept it automatically.
So, Defne, in the last question, what would you suggest for young dermatologists? How become famous and really good dermatologists?
They should focus on actual dermatology instead of the cosmetics parts, because everyone is doing the cosmetics right now. But what will differ us from other physicians or other dermatologists is that we need to focus on the actual medical dermatology. And I think we have to do a lot of research as the younger generation and publish what we are doing, because in time, when you start working in a hospital, it goes as if you see patients every day, and it gets a bit monotonous. If you continue like that, you don't get that enough. You don't feel competent with your work as well. And in the future, it becomes as if you're an old doctor and you don't have any publications. But I think starting early is very important. Being a resident, I think it's the best time that a doctor can start producing. I started writing articles when I was 2 or 3 weeks within my residency. So finding a good mentor is really important. But even though if you cannot find a mentor, you can be your own mentor. It should come within yourself. Yeah. So my suggestion for my younger friends would be that no matter where they are practicing or at what stage they are, they should start from one point and it will continue.
Great. Thank you very much, Defne, for joining to us today. And I wish you a lot of success in your academic career. Thank you.
Thank you. It was a pleasure. Thank you.
Thank you very much.